In this video, we're going to talk about a very personal and emotional loss that we see amongst couples in today's time. This is a very sensitive personal loss, emotional loss, and nothing other than habitual abortion. Having a pregnancy or being pregnant or being a mother is a desire of every female. We see that in this dream, if there are such hurdles and such painful, stressful conditions where one miscarriage, two miscarriage, 3, 4, 5 miscarriages, it is a very disheartening and an emotional condition amongst the couples. Today, while speaking to patients in over 55 plus countries, we see this is a very common problem. Patient tries again and again with no proven solution. Patient is advised for an IU or IVF, but we see that patients often ask us that pregnancy is not a problem, but the miscarriages are a problem. And I find you talking in your videos that having healthy pregnancy throughout 9 months, why is it so important than just getting pregnant? So today in this video, we're going to talk about an Ayurvedic approach and a healthy approach and successful results for such conditions of habitual abortion. Years ago explained as Putrangini Yoni Vapat. Today we're going to touch this topic and understand a few amazing part of the this topic. Some amazing concepts will be discussed and why and how Ayurveda has the best results when it comes to infertility and habitual abortions. Let's understand in this video. Namaste everyone, welcome to Jovi's Hospital of Ayurveda and Aesthetic Center, Mumbai. We're talking about habitual abortion. So habitual abortion, again, this is having many reasons. Many reasons, right from being stressed or having some genetic problems through the uterus, which is the gynecological problems, to the sedentary lifestyle, to having a lot of traveling, having a lot of different reasons of Vat. Things that increases the Vat with regards to food and the lifestyle. So in this we see torch test being positive as a major reason for a bad obstetric history. In females that have a miscarriage, we often do a torch test and we see that the torch test is positive. Torch, which is the toxoplasmosis, rubella, cytomegalovirus and the herpes simplex. In such females, if torch test is positive, we generally as an Ayurvedic practitioner across the globe, we tell patients, we inform them to work on the body and the factors that are needed for conception for a span of 3 to 4 months and then plan for pregnancy. In Ayurveda, preparation is more important than just being pregnant. This is the approach of Ayurveda about which we'll discuss. In the last couple videos, we spoke about Garbha Sambhava Samagri, which is the 4 essential factors essential for successful pregnancy and a healthy outcome. Today across the globe, we see that patients outside India, they have more importance and they give more priority to this factor, which is, in spite of having no problems, preparation and then planning pregnancy. Garbha Sanskar is an entire different topic in Ayurveda about which we'll understand. In Ayurveda explained as Rutu Kshetra Ambu Bijanam Samagya Dagruro Yata, which means the Rutu Kshetra Ambu Bij, 4 factors very essential. Rutu, which is a fertile period. Kshetra, Ayurveda explains as Kshetram Garbhashayam, which means the seeds are important, but the soil is more important. The soil where the seeds are going to be sowed is more important, which is a healthy uterus. We see a lot of reasons like the ovarian failure. We see reasons like PCOD, fibroid, hemorrhagic cyst, endometriosis. We see all these reasons being a common cause for abortion as well as infertility amongst females today. So having a healthy pregnancy, healthy uterus is important. Third one is Ambu, which means unobstructed, sufficient blood circulation. And the last one, which is the healthy ovum by a female and healthy spermatozoa by a male, which is Bij, which is Tribij and Purish Bij Shuddhikaran, explained under Garbha Sanskar, which is Garbha Sambhava Samagri. 4 essential factors, which is very essential. If we do not work on these 4 essential factors, the outcome is going to get hampered. Of course, in such patients of torch positive or gynecological problems, we work on these 4 elements and we see amazing successful results. So very important is those females with torch test positive, we see these females are of Pitta Prakriti. Pitta Prakriti, which means a Garam Swabhav, which means hot temperature, which is having a lot of stress, anxiety, chid, anger, mood swing, anxiety, And such females, because of such, reasons, they have habitual abortion, for which Ayurveda explains as per the Panchabhautik Shastra, elaborative explanation given as the chickenpox history. In such females, we commonly see 1-time chickenpox, 2-time, or even 3-time chickenpox history. And in such females, once we clear out the chickenpox history, once we clear out the fever, once we clear out the jwar, once we clear out and work on the Pitta Prakriti, when we work on the Mana, 4 essential factors, chickenpox history, fever, the patient feels a lot of lightness, a lot of cooled temperature, a lot of changes in the hormonal imbalance, and hence successful results and healthy outcome for pregnancy as well as Garbhapat, which is miscarriages. So beautiful concept in Ayurveda, about these factors. This is something that you'll definitely hear for the first time. In Ayurveda explained as Vatala Karkasha Stabda Shula Nistota Pidita, which means wherever there is pain, stiffness, obstruction, Vat is the main reason. We need to relieve the Vat. Ayurveda explains years ago that habitual abortion, which is correlated as the Putrangini Yoni Vyapat. Let's explain what the classics talk about Putrangini Yoni Vyapat. It is beautifully explained as Kshayad Vayu Yada Garbham Jatam Jatam Vinashayat Dushta Shonita Jam Naraya Putrangini Nama Sa Mata, which means that the reasons explained very specific, that the Vat reasons, the Shonita Karya, Shonit, which is a Rakta Dhatu, Ashuddha Rakta, and the Vat being the prime reason that affects the fetus. What could be the reasons of the Vat? It could be right from traveling in pregnancy, right from taking a lot of stress, right from bacterial viral infections, right from Abghat, which is trauma. All the reasons contribute to the Vat factor. These ailments affect the fetus and destroys it. Other factors like the Krumigna Karya, Krumigna, which means viral bacterial infections, and Abghat, which is trauma, being the major reason for Garbhapat. And as discussed in today's time, when we consult the patient, we see infections, amongst which torch test being positive, which Ayurveda focuses on and works on the torch, works on the Mana, works on the chickenpox history, works on clearing out and working on the 4 essential factors, is equal to healthy pregnancy. So in Ayurveda, 2 methods of treatment and diet, do's and don'ts. Medications, right from supreme Ayurvedic medications, years ago explained, available across the globe, which is the Pushpadharma, which is the Phalagruth, which is the Suvarna Vasant Malati, right from Gokshur to Ashwagandha to Shatavari to Kavach Beach. Extremely outstanding combinations and availability of herbs in Ayurveda for such conditions. Today across the globe, we see the use of Active Ved India, tablet Pro MF, as well as tablet Ova C Med, syrup Menstra C Med, used by practitioner, with them sharing successful results for infertility and habitual miscarriages. Right from Panchakarma being the most supreme treatment, where the Pitta and the Rakta, we see how it's fixed through the Virechan and the Rakta Mokshan. We see the Vat, which is fixed through the Basti Chikitsa, and the Uttar Basti, which is a supreme special treatment where the medicine directly reaches the uterus. Basti, which is explained as Bastir Vate cha Pitta cha Kapha Rakta cha Shasyate Sannipataj Samsarga Bastireva Hitam Sada. Bastirev Hitam Sada. Always Basti is useful. So in all these genetic problems, genetic disorders, all the Garbha Samskar, all the Vat reasons, we see Basti is a supreme one. Uttar Basti, which cures the problems of the uterus, right from the hemorrhagic cyst through the PCOD to the fibroids to the endometriosis. Ayurveda has a proven solution for such conditions. This was all for now. Any doubts, any questions, please do let us know in the comment section below. Until next time, from Jovis and the team, look impressive, be progressive.